And today joining in the studio, we've got Lauren Pass Erickson, MA, LPCC, RDMT. We're going to be talking about healthcare provider burnout or clinician burnout, because I want to make sure we capture all the therapists, RTs, even phlebotomists, and all these other people that are experiencing burnout in relation to COVID. So kind of some statistics that I wanted to address first were, the whole concept of burnout. In 2019, the World Health Organization categorized burnout as a syndrome that results from chronic workplace stress that has not been successfully managed. And, we're still working on a unified diagnostic tool. Really, the Maslow burnout inventory is kind of the predominant one, as I'm sure you know, and we're still waiting to kind of find a better tool, I guess, for them. The data around burnout in clinicians is incredibly concerning. It's been a concern for multiple years. I did a quick literature review of hundreds of articles, and the vast majority of them were discussing provider burnout, compassion fatigue, secondary trauma, and not really talking anything about, some about prevention, but not as much as I would have liked, and not as much about recovery. And so, to talk about it, the prevalence, really, the Association for Healthcare Research and Quality estimates that clinician burnout is greater than 50% of clinicians. And that's data from 2019. That doesn't even account for the stress of the past year. Right now, clinicians are really experiencing these symptoms. Some of the things that I always see are like exhaustion, you're neglecting your self needs, you're withdrawing from the job and from patients, you're getting compassion fatigue and some depersonalization. And I know we've all seen this in some cases that are leading to depression, anxiety, secondary PTSD, substance abuse, and some suicides. So I wanted to talk to Laura today. She's a trauma therapist. We're going to talk about preventing burnout and some keys to recognize it in yourself. So Laura, I'll let you introduce yourself, and if you want to start with recognizing symptoms of burnout.
All right. Chris, thanks for having me. My name is Lauren. I'm a somatic psychotherapist, and I focus on working with complex trauma. I'm in private practice in Colorado, and I love this topic because I'm a fairly new clinician. I graduated in 2020 in the midst of the beginning of the pandemic and everything. So that was really wild. And I've been in private practice for the past year since then. And it feels so important because I've seen so many new people entering the field that are already feeling so burned out in such a short time that it's just really wild to see that happening from people from my graduating class who should be quite fresh in theory, already experiencing signs and symptoms of burnout because of just all of the intensity in the past year.
And in all fairness to you guys, you didn't even really get a chance to get warmed up before global pandemic, by the way, so good luck.
Yeah it was an intense time, definitely. For me, it was finishing my degree, and I was at my internship, and all of that happened, of course, right towards the end of my program. So there was a lot. I had some of those signs and symptoms of burnout, I would say, at that time. And I think it's so useful to view this in a trauma lens, because I work with complex trauma, which is not so much one event, but like a lot of potentially smaller events or series of events that build up over time. And that's what I think is so relevant to clinicians and healthcare providers, that, it's not the same as, maybe being in a huge car accident or something that's more of an acute one event. It's this like slow build that kind of burns the candle at both ends for a long period of time. And so that can also be harder to see it coming, which is why, I'm appreciating that we're taking some time to talk about the signs and things that people can look for to notice that happening before it gets too out of hand, before you're at the point where you're, pretty crispy and needing to really step back from your work even.
Yeah, and that's a great perspective on it, because it isn't, I think it's really hard for clinicians to actually recognize that they're experiencing that, because it's not one overwhelming trauma. It's, like you said, this buildup of constant kind of small traumas day by day. And so it's very easy to tell yourself, "No, I'm fine. I'm fine. I'm just a little grouchy today because, I didn't get enough coffee," or whatever,
Yeah,
whatever story you tell yourself.
yeah. And I think people have a tendency to kind of push through stress, right? But the idea around that is like, oh, I'm going to push through this stressful time so that I can rest when the stressful event is over, right? But then that might work if you're having one really stressful week. But what happens when you're having a stressful year or 2 years or 5 years? You can't keep pushing through for that long because there's no other side that you're getting to. So
Yeah.
it needs to be kind of taken care of in a different way.
Wow. That is a good way to look at it too. It's that it's much harder to see a relaxing future, right? When you're in that moment. So, wow. So tell me some of the signs and symptoms that you really recognize, or so people can sit at home and say, "Oh my gosh, that is me," or, "Well, no, that's not really me."
Yeah, yeah. Okay, so I actually brought a list from that I made for myself at that time when the pandemic was hitting last year and I was at my internship, I was working with clients, I was finishing my master's degree, and I was not doing super well. And I remember my therapist was the one who pointed out to me, like, it sounds like you're burned out. And I was like, oh, that's what this is, right? So I actually sat down and made a list of everything I was noticing at that time. And I'm going to read it if that's okay.
Yeah,
It,
that's great. And actually, I'll even put it on text and we'll drop it in as a card so that everybody can kind of see it.
Please do. So, and this was my personal experience. So people might notice different things, but I have a feeling that a lot of them are probably pretty common. So I was feeling rushed all the time, just like rushing between things, feeling irritable, annoyed, angry, impatient. It was hard to wake up in the morning. I felt like just tired all day, like I could go to sleep at any point. Hard to fall asleep at night, like lots of racing thoughts at night that were preventing me from falling asleep easily. Having a lot of anxiety at nighttime, even like waking up in the night with anxiety, that was very unusual for me. That was not something I would typically have problems with. Low sex drive and like not even really wanting a lot of physical contact with people in any capacity. Feeling a lot more introverted than usual, like socializing would just be like, oh, it sounds like way too much to see people. Yeah, tired all the time, a weekend or a day of rest just did not feel like enough. Didn't feel excited about anything during my days, didn't feel excited about work, didn't feel excited about non-work things. So really low motivation was coming in. Gratitude felt really challenging. I had a pretty good like gratitude practice that I was doing at that time, and it got really hard where I would just sit there and be like, oh, I don't know. Low appetite, feeling queasy or insensitive in digestion. Exercise was difficult, both in terms of fitting it into my schedule and having the energy to do it. It just wasn't happening. Collapsing, which might be a little bit more of like a movement term, but kind of like just losing energy in the body and like not really being able to do much other than like watch Netflix all weekend. So having kind of a physical like collapse happening. Feeling really protective of my time and energy boundaries, which I think goes back to the irritability piece too, like really feeling any infringement on my time or people asking me to do things for them would kind of set me off really easily. Not keeping up with household chores, difficulty keeping in touch with friends and family, canceling plans, crying at unexpected stressors that would arise in my day, thinking about work first thing when I open my eyes in the morning. And then this last one, this is actually a big one for me. No emotional bandwidth for supporting friends and family. And that one, especially as a therapist, I think that's especially relevant because our job is about emotional connection with people, right? And I remember being at this point where it was like, I don't want to hear about your problems. I don't want to call my friends on the phone. I don't want to hear how my partner's day was. Like my capacity for being a support person outside of work just totally tanked. And that's something for me personally, that's actually one of the earlier things that I start to notice now around my stress level is like, how am I feeling in my other relationships? How do I feel when my partner asks me to help out with something? How do I feel when a friend of mine is having a hard day and they want to talk? Does that feel like something that I can show up for? Or do I start to feel kind of protective of my energy? So for me, that's actually, I think, one of the earlier ones that I start to notice that can maybe be a little bit more subtle. But how am I relating to other people outside of my clients? So
I think
that's
that's a
one that would
really,
highlight.
yeah, I think that's a really good barometer for a lot of people. And, I have a list of like 13 stages of burnout, and a lot of these were on that list, and they are things that, you really have to take a moment to say, is that why I'm doing? And I think what's interesting, you brought up a great point, is that I think a lot of the time people recognize this when it's in relation to their other relationships.
Mhm.
So, you think you're maintaining, and then your partner does say, that wasn't good, what just occurred, right? Or, they ask you to do something, you totally lose it because it feels just like that one additional task is just too overwhelming.
Yeah.
And
Yeah.
what we see a lot, and I'm sure you see the same thing, is a lot of times it's people's partners or parents that push them to get help.
Yeah. Yeah. Because a lot of times other people in your life might notice changes that you don't notice as much, or they might notice, a problem happening relationally that you're not as tuned into. So that can be a really good reflection also.
Yeah. Well, I also love these things like, you're not sleeping, you're anxious. That's, you kind of brought some memories back for me in graduate school, where it was, just didn't have the energy to hear about anybody else's relationship or problems. And,
Yeah. Yeah.
so these are some great signs to watch out for. I think that hopefully that somebody will be sitting there and say, okay, that's me. I'm way too irritable. This doesn't make even sense anymore. Like, I'm snapping at the littlest of things. What can we really do or what are some of your favorite modalities for preventing burnout?
Yeah. So I'm a somatic therapist. So everything I do is always bring it back to the body, right? What's happening in my body and my sensations, and both in terms of physical health, but also emotionally. How am I noticing how emotions and trauma and stressors are impacting my body? And so I think that self-awareness around that is a big piece, and that connects to what we're talking about of like noticing signs and changes that might be happening and noticing how your nervous system is reacting to different things. And then giving yourself supports around that. How do you take care of yourself on a moment to moment level, on a day to day level, on a year long span? Um, I think a lot of self care stuff comes back to really basic, like sleep quality, food quality, movement. That's another place that's a big passion of mine. I'm a big dancer, and so that's what I do to move and express myself. But there's so many different options for movement and exercise, and just getting that energy, that stress, the things that you might be kind of holding or clamping down on throughout the day, which is the like, I'm just going to get through it kind of response, right? How do you get to actually let that move through your muscles and your bloodstream and your breath, and just release some of that tension in quite a literal sense?
I can't say enough about movement and exercise in whatever form you can obtain it. If you're fortunate enough to be able to walk outside for 10 minutes a day, I think that's a huge help. But I love what you're saying about it. Like, it does kind of help you feel that energy and feel it dissipate and feel some of the stress peel away. So I think
Mhm.
that's a concept that people really need to take to heart and try to embrace if they can.
Yeah. And there's different levels of that, certainly. Like, I think a lot of people will really focus on what might fall more into the exercise category, which is awesome. But I'm also a big fan of just like, get your joints moving. Can you roll your joints and your shoulders and stretch your spine out, every now and then throughout your day? can you set a timer and just like shake your whole body for a minute or two, when you have a short break? Anything that's going to just get things a little bit more open, expanded physically, even if it's not like a full exercise routine that you might have. Those little things throughout the day, tending to the body and tending to movement, I think make a big difference as well, so that there's not such a big buildup as well by the end of the day.
Yeah, well, and for me, it's like when I think about it, it's this chronic stress is what we call a sympathetic outflow. It's that fight or flight response. So if you're building that tension all day and just clenching and holding it up, like, yeah, it's actually going to eventually lead to some longer term damage. But you really need to, just for your own mental health, shake it out, move around. If you're not able to exercise, or for me, it's my memory always goes to sitting in an operating room during like an 8 or 10 hour case, and you got to get up and move and stretch, and it just
Mhm.
really helps to clear your mind, refocus you. I think it's something that everybody needs to work into their day. So let's talk more about, you brought up a concept before this interview about embedded self-care, and I kind of want to hear more about that because I think it's really important.
Yeah, awesome. Yeah, so embedded self-care is talking about self-care that's happening basically in session, or maybe even like in your short gap, 5 to 15 minutes between sessions, depending on what your job looks like. So there's a lot of time I think that people can think about these bigger things of like, oh, I need a vacation, or on the weekend I'm going to do this, or after work I'm going to do this, which is also so important. But embedded self-care is, how are you actually taking care of yourself while you're working, while you're with your clients? So for me, when I'm in session, again, I'm tending to my body all the time. Being on the computer, I find it really helpful, especially to pay attention to my back body, making sure that I'm like actually using the support of my chair and feeling my back, feeling my pelvis, my feet on the ground, rather than like, I feel like we get into this like forward, like sucked into the screen, where I'm like leaning forward all day and then my neck gets all cramped. And so that's kind of one just example of something that I'm doing. And that also helps for coming back to myself, as opposed to being so drawn into maybe what's happening with my client, coming back to kind of my own anchors in my body and in my own spine. Tending to my breath, making sure that I'm breathing, that my breath is deep and relaxed while I'm with someone who might be in a more heightened nervous system state. That feels really important. So there's all sorts of things that people can do. I know therapists who like to have like stress balls and like fidget things. That's really helpful for them to stay grounded. Tea, water, simple things like that. It's almost like micro self-care moments of like, what are you doing for yourself when you're still with someone, you're still working, you're still present with them, but you're not just completely neglecting your whole experience while you're with your client.
Yeah, that's a really good idea. I like this. Well, it's funny, as I interview more and more people, it is funny how you kind of start to get sucked into the screen, and you find yourself just having to, remind yourself, like, sit back, put your shoulders back. And so that's a great concept. When you're sitting there all day, whether it's, at a nursing station or in a patient session or in the operating room, you tend to do this.
Yeah.
Or a lot of people would tend to start looking at the computer that they're typing on, or the phone, and you do kind of have to get up and really move it a little bit.
Mhm. And this applies to emotional impact as well, right? If my client is sharing something that has an emotional impact on me, or I'm feeling like a stress or a trauma response in myself based on what my client is experiencing, of course I need to contain that a certain amount. I probably shouldn't be having my whole emotional response needs to wait until maybe I'm with my own therapist or something like that. I'm not going to completely express those things for the client, but can I let myself feel that a little bit in the moment? Is there a way that I can take a breath with the emotional impact that I'm feeling? Can I sort of let myself have that experience to a certain extent while I'm with someone, rather than like dissociating from it, or like clamping down of like, I can't feel anything while I'm working, right? That actually, I think, contributes to the buildup, the developmental aspect of complex trauma and of burnout, when we're kind of clamping down and not letting ourselves feel, or just dissociating from the body when the experience gets intense. I think if we can also tune into the sensations and emotions that are happening and breathe with that and let ourselves have that experience in the moment to a certain extent, it's going to be easier to move through that and also to process it later on our own, compared to if we're just completely shutting it aside.
That's a really tough one, isn't it? Where, something more traumatic, I guess I hate to use that word flippantly, but where something that's more emotionally triggering occurs and you really giving yourself permission to experience the emotion in that instant, instead of just saying, I'll deal with that later.
Mm-hmm. Mm-hmm. And it's the combo of like letting yourself experience it and then also letting yourself ground, right? So it might be like, oh, I'm really feeling the impact of that. I feel it in my chest. I'm going to take a breath, and then I'm going to feel my back, and I'm going to feel my feet, and then I'm going to maybe, hold the rest of that for later.
Yeah.
And actually come back to it. Come back to it later.
And actually come back to it, because that's the key. Got to come back to it.
Yeah.
So tell me more. I know we've got kind of a list of 6. Let's talk about some of the other kind of tips for helping to stop burnout before it worsens.
Mm-hmm. Yeah, I mean, one of the things, I think I can pull up that list too. One of the things that I loved on this list too was examining your career, your work environment, what stressors are happening in your actual place of employment. What are your hours? What's happening in your actual workplace, and how is there, I mean, this is difficult because this is like a systemic issue that's harder to address. But what are changes that could potentially happen in the workplace that would be supportive? What are places for advocacy in the workplace, or stressors that could be shifted? Because that's the other piece of this. We can talk all day long about sleep and exercise and embedded self-care, but how much is that really going to do if you're working like 80 hours a week with high intensity clients, right? And then we start to talk about, how is our healthcare system set up in a way that's just really not supportive. So maybe I'm tangenting. I could get on like my soapbox about that.
No, you're talking to the right crowd for that. So it really is. How do you manage higher, sicker and sicker patients, or more complex patients, but still hope to have some control over your things that, hours, schedule, that kind of stuff. So I think it's really important to take a look at, well, what can I control and what can't I control?
Yeah.
And try to focus on what you can change.
Yeah. And I think that's so good to think about, like, what is in your control, what is out of your control, and where are kind of the wiggly pieces. You're not going to change the whole system overnight, but is there maybe a few things that you might be able to advocate for, or that might be a little bit flexible to improve your situation and the situation for your coworkers?
Yeah, that's a great. And for a lot of people I've seen, some mild coworkers drop to like 3 days a week instead of 4. And
Mhm.
that alone, if you can do that, makes a huge shift in your outlook, your ability to maintain self-care, and can even help re-engagement.
Mhm. Absolutely. Yeah.
Which actually is another one. So staying engaged or re-engaging, right? Like,
Mhm.
what are some tips you might have to help people stay engaged, or to actually make a conscious decision to re-engage?
Being really cautious about like cynicism or skepticism, or like a jadedness that can come in for people, especially for folks who have been working for a long time. Are you being just really dismissive and cynical about your patients or your clients or things that you're seeing? So that's something I would watch out for. And also I would encourage people not to engage in that with coworkers, because I've seen that happen too, where it can be really tempting to, vent about your day or about how things are going, but it can really feed this this unhealthy fire around, being really cynical about the work. That's actually not helpful.
Ooh, I'm so glad you said that. I love this whole cynicism piece, and you're right, to kind of rehash it with coworkers really only increases the negativity in the space. It doesn't really help to um, improve anybody's outlook. So
Yeah.
great.
Everyone has that time where they need to vent
Yeah,
about their day, and that's okay.
totally.
But it's like, is that the only conversation that you're having with, you're right,
Yeah,
with the people you work with? And, simple thing too, I think, like focusing on successes.
yeah,
When do you have success with clients? When do you have patients that get better? When do you have little wins in your work, or maybe really big wins that it's easy to not pay those as much attention, because we tend to focus on problems and things that we still need to work on and things that aren't going well that need more energy perhaps, but really taking time to celebrate the good moments and the successes and the things that probably brought us into this work in the first place.
oh my gosh, I'm gonna like underline that, highlight that, bold. I think that's huge, right? It's so important, that self-awareness of like, okay, that's a really cynical thought I just had. Is that really helping me or is it not? And then focus more on like, that interaction went really well with that patient and that family. I'm gonna use that. I'm gonna remember that the rest of the day. That's really gonna help me.
Mhm. Yeah, yeah. And this is where you can deepen that by coming back to your body sensations too, right? Like, how are you actually feeling when you're having that really cynical thought? How are you sitting? What's your posture look like? What sensations do you notice? How is your breath when you're having that really cynical train of thought compared to that, oh, wow, that just went so well with that patient. I feel really good about that. And then same thing, taking a minute to notice, like, oh, this is what I notice about my body, my posture, my breath, my mood. How is that changing my physical, literal experience when I'm taking in that positive experience that I just had or that I'm remembering?
That was great. I I can't wait to put that in. Okay. Um, Building a support network, and this is one that I think is really
Mm,
important for all of us that are caregivers and providers, because it is a very demanding career that we've chosen, right? It is hard to day in, day out give to other people. And so, I'd love to hear kind of your thoughts and who really is your support network, or how you maybe have multiple ones, both career and regular life.
yeah, yeah. Yeah, it's so important for helpers to also have support and social support and communities and all of that, so that we also have energy and social resources flowing towards us, right? That we're not just in the giving state all the time. For me, I mean, my partner is incredibly supportive. I feel so fortunate to have him and to have that be very positive in my home life. I have my own therapist as well, which is really helpful to have that support throughout, both grad school as well as my current work. That feels so vital to have someone that I can turn to, where it's like, okay, I'm going to be the person, and then I have to have my person,
Yeah.
right? Um, and also kind of in the work realm, having professional colleagues and friends that I can talk to who are in the same field is really nice, to both as friends as well as people I can consult with and just share experiences with, so that they understand what I'm going through. So I feel like I have my kind of work related peer group. And I think it's super important to have a non-work related peer group. That also feels really important to me, to have a diversity in, family, work friends, other friends, therapists, supervisors, so that there's kind of a network happening, that I get support from different sources and for different reasons.
There's a lot of research about the benefit of a mentor-mentee relationship for caregivers and clinicians. Do you currently have a mentor? Is that something that you're kind of looking forward to, or looking for?
Yeah, I would consider my current supervisor a mentor, someone who I definitely look up to both personally and professionally, and is doing very much the type of work that I would like to be doing, down the road. So I find it very supportive to have her in my life and to get her feedback, both literally, clinically, as well as sort of having a role model and someone to look up to in the field.
Tell her the research shows it's even beneficial for her. So it is really, it's a great way to re-engage as well. I found that in kind of the research I had done. So
that's also a great way to introduce some variety, if people are working with clients, but then maybe also doing some supervision or also doing some teaching or also doing like an advocacy role, right? Then you have like a little bit more variety in your week and like different types of things that you're doing.
The variety, in your day-to-day schedule, I think really does help to prevent burnout. So tell me a little bit about resilience and working towards resilience.
I think I find resilience as the ability to bounce back, right? To have something happen that maybe has a huge impact on you, and to be able to sort of like almost like a buoy or something, you bob back up to the surface of the water rather than kind of sinking down to the bottom of the ocean. So that's kind of how I think about it. And then the question is like, okay, well then what is that? Like how does that happen for people? I think a lot of it comes down to supports, just like we're talking about. When you look at trauma and the people who develop PTSD versus those who don't, it's not that they are stronger people in terms of the ones who don't develop PTSD. It's not even that the traumatic events were less intense or anything like that. Usually it's, well, what kind of support did the person have to go through that experience? Did they have any support? And usually if someone develops PTSD, it's because they didn't have any support. They didn't have the self-care. They didn't have the social support, which I think really is probably the biggest one. Your physical, emotional, social support. You can even think of like the hierarchy of needs, as well as, maybe therapeutic support, people who are validating and listening and helping someone through. That's really what makes the difference about kind of how the course of trauma goes for someone. So when I think of resilience, there are certainly kind of internal qualities like we've been talking about that people can work on around like positivity and gratitude and self-care and somatic awareness and nervous system regulation, right? There's a lot of internal things that can happen. But then there's also the people in your life, there's your mentors, there's, all these other humans or potentially groups or organizations or, whatever it may be that can help people bounce back.
For me, it's more of just how do you build more resilience, or how do you, I guess you really answered it well in saying that you develop your social network and you work on staying positive, and that's how you increase your resilience. Your ability to bounce back is by kind of doing, wrapping in some of these other items and improving everything underneath. I guess if I think about it on a really simplistic level, you're building a net underneath yourself so that when you have something to bounce you back up.
Mm-hmm. And another thing I hear people talk about is meaning making. And how do you make meaning of your experience? How do you understand the world? How do you understand suffering and bad things that happen to good people? What structures do you have to understand the world around you and move through it in a way where you can have some kind of anchor around just your beliefs or your perspective on why the world is the way that it is, why things happen. For some people, it can be really protective if they have a really strong kind of schema of how they understand the world and make meaning out of things.
That's a good concept. That's a really good one, even for just, I think remembering why you do the work that you do. It can even be very, very beneficial. So that's kind of the main 5 that I had. Of course, I always want to say, like, if you are noticing that it's becoming problematic, I really want everybody to go. I wish I could say right now, go out and find a trauma therapist right now. I know that everybody's schedule is way booked, but I do hope that that people link up with therapists and really start addressing that as a self-care need,
Mhm.
because I think it's one that has not gotten enough attention until just recently.
Mhm. Yeah, I really agree with that. I think therapy is hugely beneficial. Working with someone who's a trauma therapist or who's familiar with vicarious trauma or burnout, can really be a huge support. And it doesn't have to get to that point before you see that person too, right? You can have that also as a preventative resource, and I think that's something that people don't think of a lot of the time. Usually by the time someone shows up as a therapist, they're already experiencing a lot of these things. I always like to remind people that an ounce of prevention is worth a pound of cure. So if you can think about your self-care, if you can think about seeing a therapist or start seeing a therapist, or start working on some of these things before it becomes a problem, before you start noticing some of those signs of burnout, that's really, I think, what's going to promote resilience in the long term.
That's a concept that is constantly being brought up on our channel. If you treat it before it becomes incredibly problematic, it's much easier to deal with.
Yeah, I so appreciate talking about all of this, and I really hope that people take it seriously and start thinking about the personal application for themselves.